Hi everyone, welcome to Coding Manasa channel. In today's video, we will see the table of drugs and terminology and how to code. Whether how to code drugs. Whether it is overdosing or underdosing, assault, intentional accident, or whatever terminal. First, you need to understand how the table of drugs is. These are the this one column is like entire drugs. Based on alphabetical order, they have arranged it, and you see here poisoning, accidental poisoning, intentional poisoning, assault, then poisoning undetermined, adverse effect, underdosing. Okay, if you understand these terms, that means you can code from table of drugs and chemicals. Okay, what is poisoning? Accidental, intentional, assault. Accidental in the sense, without knowledge of what dose prescribed by the physician, the patient unknowingly is taking two medicines. Okay, if one medicine of 100 mg is prescribed, for example, and unknowingly she is taking a 500 mg tablet, okay, then it causes poisoning, overdose, right? So suppose due to the memory loss patient, if he or she thinks that she has not taken medicine which she already took, and she's taking another medicine after 1 hour, that causes poisoning. It may be any reason. Okay, if than the prescribed dose, if the patient is taking more dose, okay, more tablets, more capsules, that causes through accidentally she is taking, he or she is taking, okay, that causes overdose, that is said to be poisoning accidental. Then second column is like poisoning intentional. Poisoning intentional means intentionally to self harm himself or herself, she's taking overdose. Instead of taking one tablet, she's taking 10 tablets due to emotional disturbances or sorrow or anything. Reason might be various reasons, but in order to self harm or to end up their lives, if they are taking, that is said to be suicidal, right? So if they are taking more tablets than the prescribed dose, then that is said to be poisoning intentional self harm, that is suicidal attempts. Okay, then poisoning assault. Poisoning assault is used for knowingly, if somebody is wanted the patient to die, means that is said to be assault, poisoning by assault. Somebody is forcibly giving medicines in order to kill him or her, okay, to the other person, then that is said to be poisoning assault. Okay, then poisoning, and it means that in the medical record, if they are nowhere mentioned whether it is accidental or intentional or assault, then you have to pick the code from poisoning undetermined. Okay, then coming to adverse effect. Adverse effect is nothing but at the therapeutic use, if the patient is taking medicine and it's not that medicine is not suitable to the patient, and it is causing side effects like skin allergy, rashes, then headache, something like that, vomitings, like that, then that is said to be side effect or adverse effect. Okay, then underdosing in the sense than the prescribed dose, if the patient is taking half tablet or lower dose medicine, she has, if doctor has prescribed 500 mg tablet, and she is just the patient is getting purchasing only 100 mg tablet of the same drug, that is that if she takes that, it will not show any therapeutic use, right? Then that is said to be underdosing. Okay, especially in hypertension patients, then in diabetic patients, if they are taking less dose medications, okay, that causes underdosing. Okay, if you know, if you understood all this, then it's very easy to code from table of drugs and chemicals. And these are the not the complete course. You have to give the seventh character, like we saw in the previous video of neoplasm table, right? Sorry, we saw in the previous video of mine, fracture care coding, like we saw the seventh character coding, like a to yes, right? Here also you'll have seventh character, and seventh character is of a, d, and yes. Okay, a is for I'll show you. Wait, seventh character this, for example, I have taken this, and seventh character is this one: initial encounter, subsequent encounter, sequela. A means initial encounter. Initial encounter means for the first time, due to toxic effect, for the first time, the patient is being seen to the doctor. Subsequent means follow up visit. Okay. S means sequela. Sequela is nothing but late effect. Late effect means which in the some days ago or months ago, so she was on medication, and now due to that medication, she is getting some problem now. Okay, that is said to be late effect or sequela. Likewise, you'll take seven character, and you'll give the complete code. Any drug you take, you can code from table of drugs. Okay. uh, Likewise, you have A to Z, any number of drugs, right? Anything you can take and you can quote. Okay. See, oils, every drug has its own codes. Okay, own codes, and you have to go. And it's not the complete code, my friend. You have to give the seventh character as well. If you click here, it will take to the tabular index. Okay, and see the seventh character. This is how you code table of drugs. Okay, so I hope this video made you very easy to understand table of drugs and chemicals. And if you know the terminology, it's very easy. Coding is very easy to code from table of drugs and chemicals. Please like the video if you like it, share it to your friends, and subscribe to my channel for more videos. Thank you so much.